with patients. There he is. Hi, Jake. So nice to
Hi.
see you.
Hi, everybody. Let me
Hi,
adjust my
welcome to the
camera.
Maskathon.
Thank you. I was just finished working out, so I'm not fully masked, but I used it earlier, and I definitely am ready to glow today and share some interesting information with you. This is so cool.
It is so cool. So you're working out. That means you also have your anti-inflammatory moments and de-stress and taking care of yourself. I'm so happy to hear that.
Yeah, I mean, I think that we're all trying to figure out how we could take care of ourselves while life is not normal. But every moment that we do take a step back, especially during these crazy times, is incredibly valuable. So for myself, it's very important to make sure that there's a workout each day. You're taking time to step away from the stress and the craziness, doing things like meditation, spending time with family, doing lots of Zoom and teleconferencing. That really goes a long way to sort of keeping a balance that is critically important, because I think we're very skewed in very heavy topics. And to keep that balance is one thing that I'm finding to be very helpful for myself.
Speaking of these heavy topics, there's a lot in the media right now, and it's very confusing about what's the situation. And you're on the front, you see it every day. Tell us a little bit about what is the situation right now? What can we expect in the next 2 months or so? What's the prognosis here?
Yeah, so I mean, it's interesting how things have changed in not that long a period of time, from when we first started treating patients with COVID to then being able to test them, learning information about testing people and identifying illness, to now we're really in a different phase of identifying who is sick and testing more for antibodies. So we've definitely seen a plateau of the number of illnesses. We're seeing less of people coming in for actual COVID, and now some of the concerns after the fact, and trying to identify who had illness and wasn't tested, whether people have immunity with antibodies, and what antibodies really mean. Does it mean that you have immunity for a month? Is it for the year? Is it going to be even longer? So we're really on the forefront of a very fast changing illness. And so it's super exciting. At the same time, like I said, it hasn't been the easiest time, but as a physician, it's been incredibly rewarding. And, to be part of the process, to be making history, working with the incredible team that I have in my offices, I couldn't be more proud of some of the work that we've done, and the help that we provided for people.
So thank you for this. This is amazing. Jake, so what do you think? Because people are wondering when they can go back to their normal life, and lots of people need to go back to their jobs, and there are lots of businesses really suffering. So lots of these questions are really about how long do you think this will go on, and if we go back, do we run a risk for a new wave of of COVID?
Sure. I mean, I wish I had all of those answers. I'm definitely not an epidemiologist or a public health expert, but there's going to be some need of normalcy to happen in the near future. And what that looks like is, in one hand, very scary, but on the other hand, I think can be promising. Once we start to identify the real number of people who had infections, we're going to be able to have some sense of normalcy, because we're going to be able to contain new infections. That being said, there is a likelihood of some increased number of infections as we go back to normal, but I think that we're better prepared. We certainly have learned a tremendous amount about this illness. We've been able to supply the necessary equipment like the PPE for people who are taking care of these patients. And just a general sense of fear has sort of calm down. And I think that that's going to be helpful as we go into the next phase. I do believe, though, it's inevitable that we'll have some more illness that's going to peak again. But hopefully we're in a better position to manage that. And, there's not going to be as much tragedy and much loss as from the first round.
How is it that lots of people die and lots of people have no symptoms at all? Is there like a factor in maybe the genetics or age, or underlying problems which can, increase the risk of getting COVID and getting really bad symptoms.
Absolutely. I mean, in my own practice, I've seen people that have family members that were critically ill and themselves being very ill. Similarly, my own personal experience, I had COVID. I was very sick, actually had pneumonia on both sides. And my father was very, very ill with COVID, having been in the ICU and was on a ventilator. So I can speak very clearly that there is a family sort of experience that happens. It's genetic. So I think that that's one of the most difficult things, is that we see people who have very little illness and then people that have the far extreme of life-threatening illness. And that's where it's difficult for people to wrap their head around. When you can't connect with the seriousness, when it seems distant, it doesn't seem like such a big deal to reopen the country. But when it becomes your family, when it becomes your loved one, everything kind of changes. So that's the disconnect that we're still dealing with.
And another question, I think what's happening right now, people are getting a whole new idea about hygiene. And I think, everything you do for a longer period of time becomes a habit as well. So I think the social distancing and washing their hands on a regular basis and really paying attention to germs more. I think the kids growing up with a totally different mindset in this area, this probably will also help in the future to avoid those kind of pandemics. What do you think about that?
Absolutely. I mean, everything is going to be recalibrated, how we interact with each other, how we approach day-to-day life, whether it's travel, whether it's our own healthcare, choices that we make about how we eat and take care of ourselves. So I think that there's quite a bit of positivity that is potentially going to come from this. And certainly we're not going to take for granted the freedoms that we had, the sort of unlimited healthcare that we've had, just being much more mindful about what it is to interact in the way that we have. And I think that that's going to be an incredibly positive element. I also have seen just tremendous joy amongst people in celebrating humanity and being more kind and more patient, whether it's in the medical field or, when you're at the grocery store. So, there's really no medicine involved there, but there's such a great value for that part of what we may see as an outcome from this, that I think that we should be pretty positive about that. That's something exciting for me. Certainly, we're going to find breakthroughs in treatment, and we should have a vaccine, in the near future, because everybody's working so diligently. So that's one thing that we could, I feel, count on. But having humanity benefit, having just a general sense of wellness and positivity that is transpiring, I think that that's probably the most exciting outcome that we could hope for.
That's great, and I feel the same way. And you said something about taking care of our health, and this is something we want to talk about today as well. And this is also including an anti-inflammatory lifestyle. I'm all about anti-inflammation and how to take care of ourselves, getting enough sleep, trying to distress, having a healthy diet, and really taking the best care of our bodies and health and reducing inflammation. I think is really the key to also strengthen our immune system and making our bodies really strong and, really ready to also fight certain diseases.
For sure. I mean, I think that diet is probably the one most underestimated element of immunity and keeping a healthy overall balance. Because if you think about our immune system, a significant part of it lives in our digestive tract. So making sure that we have a balanced diet, making sure that we're eating well, simple things about taking care of ourselves with nutrition is such an easy fix. Also, what we talked about, exercise. I mean, I think that everybody has a newfound appreciation for exercise when it was taken away from us. The convenience of gyms and other activities that we were used to now became very difficult. So, I think that is something that we should never underestimate the value for overall health. And then certainly stress. There is a tremendous amount of stress associated with just dealing with these times, whether it's watching the news or dealing with your own illness or financial stress. So, managing stress is probably one of the most crucial factors that we have to think about in our overall health. I've seen people have heart disease that's accelerated from stress, or diabetes that becomes out of control because of stress. So we have to be very mindful for that. And I mentioned a little bit about meditation being one of my personal favorite solutions. I see a lot of patients that were very, very scared about dealing with COVID. And oftentimes, it wasn't a prescription that was necessary. It was something as simple of, using an app for meditation and adapting those procedures that really came to the rescue for those patients.
This is also, this will be a topic today as well, how to reduce stress. Thank you so much, Jake. Give my love to Brian. You guys are amazing. Thank you, thank you, thank you. And
I don't have my
stay
mask,
healthy.
but I don't have my mask, but I have my favorite cream.
Yes.
I live for this.
Thank you so much. Thank you, Jake.
Thank you. Have a great mask-a-thon. Bye, Charlie.